Hey everyone, welcome to Tuesdays with Tina. It is January 16th of 2024 and I'm trying something new with this session. Right now the Northwest is covered with a cold snap and I'm getting freezing rain here in my hometown of Salem, Oregon. And so there was no patient care today. I was supposed to see patients and we just canceled college classes for tomorrow as well. So I've had the opportunity to take a little bit of a downtime, but also play with some new things. So we're going to give this a try, and I hope that you all like this and enjoy it. What we're going to talk about today are some tips on doing palatal injections, hence this picture that we see right here with my recording. Now, if I've done this correctly, you're going to see the picture and me. So fingers crossed, right? And I appreciate y'all sticking in. So a couple of tips to help you do your palatal injections. So one, make sure you have your patient, when they're sitting in the chair, have them tilt their head back. So that way you can really see the palate. You want to have them tilt their head nice and far back, almost kind of like they're looking back behind themselves. So you're going to have them tilt their head back. That means that you can see into their hard palate a lot easier. You may have to tilt your head a little bit so you can see that hard palate, especially with some of the items that we have coming up. But have your patient tilt their head up so that maxillary occlusal plane is perpendicular with the floor. So that's one thing. The other thing is you want to check for your patient's anatomy. Now, see, look at this beautiful picture here, how you can see the nerves flowing, the nasopalatine, the greater palatine nerves flowing up. We want to make sure that we are palpating that area. We're looking at the incisive papilla. We're looking at that median palatine raphe, looking at the palatal fat pad, assessing to make sure that we don't have any tori in our way, any pizza or coffee burns, right? I can't be the only one that gets super excited when that coffee or that pizza comes out and you go for it and burn the roof of your mouth. Yes, your patients will do that too. You want to identify, make sure there aren't any burns or infections in the area that you want to inject. Really palpate that area, especially if you're going to do the AMSA injection. That will definitely be a nice key area to palpate so you can feel how thick that tissue is, okay? So one, tilt your patient's head way back, have them look like they're looking back behind themselves so you can see that hard palate. Palpate that hard palate as well, evaluate it, look at it. Number two is pressure. You want to make sure that you're applying some really good pressure anesthesia on your patient's palate when you're giving your injection. Beforehand, put some nice firm pressure on there, about 30 to 60 seconds. And then even while you're giving your palatal injection, keep that pressure on there, slide that swab out of the way a little bit. You can go ahead and insert and then deposit your tissue. I always say that applying that firm cotton swab pressure is almost kind of like having slow, firm pressure being pushed down versus a hard stab of a needle. So your patient will much prefer this firm pressure being applied. Basically, it will kind of deaden that area, almost like when we fall asleep on our hand. And then we can go ahead and do that injection. The other thing is when you are all done injecting, pull back on that syringe a little bit and aspirate when you withdraw. That makes it so that anesthetic solution doesn't dribble down into your patient's mouth. Okay, very, very helpful to make sure that doesn't happen. All right, friends, just a few quick tips there for you. I hope that you're all doing well. This last week has been a lot of fun and exciting for me. I got to share these tips with the Georgia hygienists as I did a anesthesia recertification course with them. It was a crazy busy travel time coming back with canceled flights and weather delays. And I would tell you, I think I'm pretty grateful that we didn't have any patient care today because it was pretty exhausting. All right. Yes, joys of travel, but it was very exciting to get to share anesthesia tips with some of the hygienists in the state of Georgia. And I'm looking forward to going back at the beginning of February as well. So with that, enjoy those tips, reach out, let's have a discussion. If you have further questions, you can always head to teachertina.thinkific.com to learn more about injection techniques. And or if you are interested in your anesthesia certification, send me an email or send me a message, and I'm happy to share what I know. Thanks, friends. Bye.